Welcome to MD Conversation. This module discusses breast self-examination, or BSE for short. There are other modules available that describe other aspects of breast health. This information is taken from a recent review of the medical literature and attempts to be as transparent and comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or skip through them in any order you wish. Last year in Canada, over 5,000 women and men lost their lives to breast cancer. Breast cancer is the leading cause of early death in this country. However, it can be detected early and can be treated effectively. A woman's breast is composed of glands that produce milk, ducts that transport milk, supportive connective tissue, a nipple and surrounding areola, and fat, which gives the breast its size and shape. Most women experience periodic changes in the shape and contour of their breasts, often during puberty, pregnancy, and menopause, and due to such factors as the menstrual cycle, weight gain or loss, use of birth control pills, or aging. Such changes include a lump or lumpy area, a thickening of the breast tissue, an area that feels different, indentation of the nipple, discharge from the nipple, puckering or dimpling of the breast skin, a change in breast shape, or pain. Sometimes, a change in the breast can indicate a health problem, such as breast cancer. Although this will not be true in most cases, it is very important that all breast changes be investigated, for if cancer is found, the earlier it is detected, the better the chance of effective treatment. Normal breast tissue has a soft, dough-like consistency, and to the pads of the fingers can feel pebbly, fibrous, grainy, or lumpy underneath. Breast abnormalities, on the other hand, are the different than your usual masses of tissue located anywhere in or on one or both breasts, including the tissue extending from the breast to the armpit. Becoming more familiar with your breasts through breast self-exam, BSE, can help you tell the difference between normal breast tissue and a breast abnormality. Every woman's breasts are different, so it is important that you get to know the look and feel of your breasts to better find any changes unusual for you. Women aged 20 and older, including those women with breast implants, ideally should perform BSE once a month. The best time to perform BSE is just after your monthly period has ended, in those first few days when the breasts are least tender. For women who no longer have periods, BSE can be done on the same day each month. BSE does not need to be performed more often than once a month. In fact, checking the breasts too often may mean missing subtle, gradual breast changes. Please note that BSE is used alongside and does not replace regular clinical, doctor-performed breast exams or mammograms. A BSE is a visual and physical inspection of your own breasts, done while both standing and lying down. The breasts are checked for their usual size, shape, and color, and any unusual distortion or swelling, spontaneous nipple discharge, dimpling or puckering of the skin, inversion of the nipple, redness or lumps. This presentation discusses 4 basic steps to a breast self-exam. First, undress from the waist up and begin by just looking at your breasts in the mirror with your arms at your side or on your hips. Check that both breasts are their usual size, shape, and color without any distortion or swelling. Look for a change in the nipple, a change in the texture of the skin, and any lumps. Next, while still in front of the mirror, put your hands behind your head and check the appearance of your breasts again. Then, feel your breasts while you are lying down. Lie on your back with your right hand behind your head and a pillow under your right shoulder. With your left hand, using the pads of the fingers and keeping them flat and together, feel the entire right breast from top to bottom, side to side, from the collarbone to the top of the crease under the breast, and from the armpit to the space between the breasts. It is important to check the surrounding areas, as breast cancer can be found in nearby lymph node tissue and under the arm. Feel for any lumps, thickening of breast tissue, or areas that stand out as different. Take notice of a lump that persists or gets worse or more obvious over time. Once you have finished examining the right breast, repeat this process for the left breast using your right hand. Be firm but gentle when examining the breasts, and examine each area with 3 levels of pressure. A very soft touch at first to feel just under the skin, then with a medium touch to feel a little deeper, and finally with a firm touch to feel the deepest breast tissue closest to the breastbone and ribs. It is helpful to follow a pattern when performing breast self-exam to ensure you cover the entire breast. For example, you could start by circling the nipple and move in larger and larger circles outward toward the edge of the breast. Or, you could move your fingers up and down the breast in rows. Also, you could divide the breast into sections like pieces of a pie, feeling the breast in one section and moving to the next. For any pattern, whether moving around the breast or in straight lines, the fingers should move in tiny circles the size of a dime. Also, it doesn't matter which pattern you choose, but it is best to use the same technique each time. Finally, feel your breasts while you are standing or sitting. Many women find it easiest to examine their breasts while the skin is wet and slippery, so they like to do this step in the shower. Other women find it easier to slide their fingers over the skin with a skin lotion. Raise your left arm, and again, using the pads of your right fingers, examine the entire left breast using the same hand movement you used in step 3. Then, raise your right arm and use your left hand to examine the right breast. Record your observations and mark the calendar for next month's self-exam. Factors that can affect the accuracy of breast self-examination include changes to the breast and breast tenderness during menstruation, examining the breasts at inconsistent times each month, and natural generalized lumpiness that may make BSE difficult, as lumps can be all throughout the breast. A breast self-examination should not cause any discomfort, though the breast can feel tender around menstruation. If you feel a lump in your breast or notice any other change in your breast, don't panic. If you are due to start your next menstrual period within a week or so, wait until after it is finished. Many non-cancerous lumps will go away by themselves with menstruation. If the lump persists after your period, see your doctor. The majority of breast lumps are not cancerous, but getting a doctor to check the lump can ease your fears. If it turns out that an area in your breast is indeed cancerous, by seeing your doctor early, you will be speeding up the process of diagnosis and treatment. For more information on breast abnormalities, please refer to the module in this series titled Understanding Breast Lumps. A doctor will evaluate a breast abnormality by asking you your medical history, giving you a thorough physical exam, and sometimes performing diagnostic imaging tests such as a mammogram or ultrasound, and sometimes sampling breast tissue through biopsy. Experts disagree about the need for regular breast self-examination. Some recommend it, while others do not. It is thought by some that BSE does not help detect breast cancer earlier or show evidence that it saves lives. Nevertheless, breast self-exam is a very useful tool for learning the normal look and feel of your breasts. To summarize, breast self-examination is a visual and physical inspection of the breasts. It is ideally performed once a month while standing and lying down and with a consistent pattern. Breast self-examination familiarizes a woman with the normal look and feel of her breasts, potentially making the detection of a breast abnormality faster and easier. Please consult your doctor or other healthcare professional for more information on breast self-exam. Other modules in this series include Understanding Breast Lumps, Understanding Breast Biopsy, Breast Imaging through Mammogram, and Breast Imaging through Ultrasound. Here are just a few of many resources available to educate you on breast health, breast cancer, and breast biopsy. These resources may also assist you. We sincerely hope that this module has furthered your understanding of breast self-examination. We wish you the best for the future and thank you once again for using MD Conversation.